I had the experience when I went to my 30th high school reunion this year in the town I grew up in of nobody knew who I was, except that they finally recognized I was Dr. Berwick's boy. And the people who, then they couldn't wait to talk to me, to tell me about the time my father had delivered their baby, or had delivered them, or had sewn up a wound, or had answered a tough question. Not a great doctor maybe, but a very good one. They said he was always there, you could count on him. Now, he retired 10 years ago, and shortly after that, he began developing symptoms of Parkinson's disease and a slight dementia from multiple small strokes. He stayed alert, and he takes a lot of pleasure in his grandchildren, but he became weaker, and then finally one day, this past June, he fell and he broke his hip. I want to tell you the story of that. He fell in his own house. He tottered once too many times up the 3 stairs to his bedroom, and he fell forward on his hip and on his head, and he bruised his head and he broke his hip. His housekeeper found him, and she called the ambulance. My brother, who lives about an hour from my father's house, rushed to the local hospital to meet him in the emergency room, and then he got there and he asked for my father, and he was told that my father was not there, even though he was. A lot of panic phone calls followed as my brother searched for him. Finally, someone said, "Oh yes, he is here after all," and in fact he was on his way to the operating room. Post-operatively, my father was on a special mattress that alternated sections in inflation and deflation. Within a week, however, he had a deep pressure ulcer on his right heel. It was very painful. It interrupted his early ambulation therapy. He didn't want to walk. It hurt. He became restricted to a wheelchair for most of the day, and eventually he wouldn't walk at all. He needed a transfer because his allotted hospital stay was up. He wasn't able to go home, though, so he needed a rehab facility, and my brothers and I searched very hard to find the best one. We interviewed visiting nurses and physical therapists and several local doctors, and the signals kept pointing to one place, the best around, 20 miles from his house, a Benchmark. I went to visit him in the Benchmark the morning after his admission, and he was lying there in a stupor on his bed, on his back, with his ulcerated heel pressing into the sheets. His mouth was hanging open. His eyes were rolled back in his head, and I asked the nurse for an explanation. Had he had a stroke? No, she said, we sedated him. He was combative. He hit a staff member. Now, for 10 years, my father has had Parkinson's disease. For most of that time, he can't voluntarily extend his arm, much less throw a punch. I'm sure he was angry. Take a GP from Central Connecticut and put him in a rehab hospital, and he won't thank you. But a punch, no.